So, how we're supporting the national programmes in our region are working with the two ICS STP groups. One of the early collaborations about a year and a half ago was around the Local Health and Care Record Exemplar programme. So that's the interoperability in terms of connecting up multiple theatres of care, primary care, secondary care, but also social care data, mental and community health data as well. It's a massive undertaking because historically we've created lots of separate islands of data, and joining that up is partly about the technicalities of the middleware and how we send messages around, but more importantly, it's about getting the clinical pathways agreed and agreeing how data is dealt with by the various clinicians across the whole pathway itself. That's one of the areas. Another area I'd bring to mind is the health system-led investment portfolio, which is a load of money that Matt Hancock announced quite recently and has gone to the STPs specifically to engage them with raising the overall digital maturity across the area, the STP footprint they have. So important because there are some trusts that have underinvested, some that have been more generous in their investment. And for this to become a population-wide service, it's important that there is the correct focus across all of those areas. And both of our STPs and trusts have been able to allocate money to particular projects, and we've been able to support them so far in part of that decision-making process. But we're looking forward now to also supporting an important conversation about driving these national programs through multiple places, where those places in fact are at different stages of maturity and how that would work across a sort of matrix environment. The last bit I'll talk to is the importance of dealing with the person. So we are very active in supporting the Empower the Person piece of the NHS strategy. We're really proud and delighted to have been able to tee up Liverpool CCG to be the first early beta of the NHS app. And we're looking forward to continuing to support them as they go down a longer journey. There's certainly more work to be done around the personal health records, and there is more work ultimately around using an e-consult service and other aspects of mobile and point-of-care services that we're providing to the public. So here at the Innovation Agency, we've got a fantastic opportunity, and we continue to work in an area across three things, I typically say. One, we help our partners to analyse situations. Two, because of the fantastic networks we have across industry, academia, and through the care services, we signpost to other people who have done something that could help. And lastly, and some of these really important things like the LACRA initiative, where in fact actually we act in a programme capacity area in the early stages, we do get involved in doing some of the hard work and some of the heavy lifting of actually doing the work itself.